So all of this is really, I hope, pointing toward the opportunity to create a continuum for child and family mental health care. And I'm going to really start to emphasize the phrase child and family because I think it's really an important aspect of this. So just to detail some of this, some of this terminology. So promotion is really about strategies that can make all kids healthier and able to weather the stresses that they're bound to face. Stress is a normal part of life. Stress is healthy. Manageable stressors are sort of part of developing the skills we need to enter adulthood, but there are promotive interventions that we'll talk about in a few minutes that allow kids to stay healthy even in the context or the face of stress. Prevention, so providing evidence-based supports, providing training, skills development to maintain healthy developmental trajectories even at vulnerable points. So, I think a great example of that is using cognitive behavioral therapy skills training in school settings for kids who are at some risk. And that prevention intervention really does seem to mitigate the likelihood that those kids are going to go on to develop syndromes of anxiety or depression or other particularly internalizing disorders. Early intervention, so making sure that our interventions are timely. And the goal is to restore normative, healthy developmental trajectories as quickly as possible. In order to do that, we need to have a mindset that is not a wait and see mindset, but that is a more proactive upstream mindset. And that's something that we and our colleagues in pediatrics and family medicine need to be reinforcing with one another. That our goal is really to intervene early, to pick up on signals and to respond to them, not to sit back on our heels and wait for things to develop. And then finally, when we are providing treatment, providing evidence-based treatments in conjunction with other supports that I'll argue are really largely family-based supports that are going to optimize recovery. And I'll also note when I talk about family or parents here, I'm using that as shorthand for caregivers. Kids grow up in all kinds of families. Family means all kinds of things. It includes sort of parents, kids with their biological parents, with adoptive parents, in kinship care and foster care, and all kinds of settings. So I'm going to use parent and family as shorthand, and keeping well in mind that there's lots of ways that looks in the real world.